Sex in nursing homes. Yeah, we're going there. I'm Dr. Nicole Diddick, and I'm a geriatrician who's been in practice for over 20 years. In long-term care, to go back to that, we think that sexual expression is important, but there's also issues with the consent part of things. It's a balancing act. So it's really finding that balance between the person's autonomy and their safety and the safety of others. As I was researching this topic, I came up with some approaches that could be helpful. And there's not as much literature about sexual behavior in long-term care as there are when it comes to some other topics, but there was some info that was helpful, and I will leave links to some of that information in the description box. It's often helpful from a policy point of view to develop some kind of a guideline so that there is a response and a support for sexual activity. So in a long-term care home, that might mean making a physical space for sex to happen, providing any materials that somebody might need for sex. So if they need pillows, if they need lubricant, if they need condoms or other kind of supplies to keep everything clean and hygienic, then that should be provided. Just like it could be provided for any other activity that's happening. And then I can't emphasize the consent piece enough. And really, when this mostly comes up when there's two people involved, so when there's sex between co-residents or a resident and a partner, it's really important to get consent. And a framework that makes sense or could make sense is one that we use when we're getting consent for any kind of a medical procedure, right? So when we assess consent or capacity to consent for a medical procedure, we want to make sure that the person understands their situation, that they can appreciate their choices, and that they can have some appreciation of the consequences of the choice that they make. So if it came to consenting to a sexual relationship, we would probably want to do an interview with someone, and probably someone of the same sex or gender of the person, if that's possible, and find out what is their appreciation of the relationship, what are their expectations of it, and what choices do they have. So that could be things like, how would they set boundaries, and do they know what it means to say yes or to say no? And then to understand the consequences, perhaps, of that activity. So would it be at the expense of another relationship or another activity? And what would happen if that relationship was time limited and came to an end? And if the person seems to have a good understanding of that, then they're capable of consenting. If they're not, then they're probably not capable. And so having a sexual relationship would be problematic. Some homes and some regions have sexual consultants for long-term care, and that person would be an extremely valuable resource. I've done some research into this topic, but I'm by no means an expert. And if there is an expert in your area, that would be a good person to consult. And it's like a lot of the people that we work with for other responsive behaviors in dementia. Oftentimes, somebody who has experience with sexuality in long-term care would be able to really help determine if an activity is an inappropriate sexual behavior or not. And either way, to figure out how to make sure that whatever's happening can happen safely while giving some balance to the autonomy of the person. So again, another resource that I found, a paper resource anyway, is this scale that you can use to kind of define the activity that's happening. And then if you were going to do charting, it's almost like dementia observation charting, where you can chart a behavior and what was happening at the time and what the response was and the outcome. That can be done with this little coding system from the St. Andrews sexual behavior scale or assessment scale. And then you can see what's happening, and then if you're going to do an intervention, like start a medication or do some other behavioral approach, you can see if it changed the behavior, whether it's in frequency or severity. So I'll leave a reference to that tool as well down below. Now, as a geriatrician, a lot of people ask me about when there is an inappropriate sexual behavior, what medications would I recommend? And it's a lot like my approach to responsive behaviors in dementia. It really depends on the behavior. And usually it's not just something we would throw meds at. We would want to do a more fulsome assessment, and we would want to do some non-pharmacologic intervention at the same time. But interestingly, when it comes to medications that we use for inappropriate sexual behavior in dementia, there aren't any randomized control trials. So it's all really an off-label recommendation. And as with anyone who's living with dementia, we have to really consider the risks and benefits when we're starting a medication. I often start with something like a serotonin reuptake inhibitor, so an SSRI, and that can affect libido, and sometimes it can be helpful. So I've had some success with that. Of course, the side effects of SSRIs can increase the risk of falls. Unfortunately, any antidepressant can. There's a small risk of lowering a person's sodium level with those medications as well. So they're not totally benign, but they are ones that we commonly use, and we can start at a low dose and titrate upwards very gently while we look for the therapeutic effect. We can also use anticonvulsants. So things like pregabalin can sometimes be used, and that just anecdotally, that's one that I've used a few times with some effect. So I recall one person who was doing a lot of sexual talk and propositioning of people. It was a woman actually who was doing this type of behavior, and it was inappropriate and problematic, and she got better with a small dose of pregabalin. And then other classes of medications could be used as well, including neuroleptics. You could also try hormones, although those often have very untoward side effects, and sedatives, and so on. So I will put a list of the medications that we commonly use, or that we have used, or that have been described in the literature. But again, it's an off-label indication, and it should be sort of individualized. And of course, I would have a discussion about the potential risks and benefits with the family and substitute decision maker and the person themselves. Inappropriate sexual behavior can be problematic. It can really get in the way of a person's housing and safety. So, oftentimes medication is something that's worth trying. So hopefully I've given you some food for thought when it comes to sexual activity in long-term care. It's not a non-issue, and it's not always a problematic issue, but it is something that we need to prepare for and that we need to accommodate when it comes to older adults living in nursing homes. I know if I'm ever living in a nursing home, I would hope that somebody would treat me with compassion and look at me as a whole person, including my sexual expression, and make it so that I could express myself in a comfortable way. The other thing I haven't talked about that's important is people who are part of the 2S LGBTQ plus community. Oftentimes, at least with the current cohort of older adults, there isn't a whole lot of accommodation for people from that community in long-term care. A lot of people go back into the closet when they go into a nursing home, and that's not right either. So inclusivity and diversity is very important when there's any kind of policy development or response to allowing a healthy sexual expression in long-term care homes. So maybe that's a topic for another day. Let me know what you think. And if you want to share any of your thoughts or questions or experiences, please do so in the comments section, respectfully. And if you want to know more about aging, go to my website, thewrinkle.ca, or subscribe.